Imagine a virus so powerful that it shocked the whole world and brought even the strongest country to their knees. In 2020, that became our reality, and India faced some of the worst impact. Hi, I am Priyanka. Today, I will walk you through how the world responded to India's COVID 19 crisis, the wins, the struggles, and the important lessons we must carry forward through the One Health approach. So, what are we going to learn? So, firstly, we'll look at COVID 19 impact in India from the first case in January 2020 to the deadly second wave in 2021, causing millions of infections and overwhelming the health system. Then we will explore the WHO and international response using a One Health perspective addressing human, animal, environmental and health together. Then we will learn how the global health system coordinate from sharing resources to vaccine distribution, but also where the gaps appeared. Then we are analyze the strengths and weakness like the vaccine success versus supply issue and deadly responses. Finally, we will discover key lesson, strong surveillance, fast action and the global cooperation and the crucial for the future pandemic preparedness. So let us understand about the COVID-19. The name of disease is COVID-19. This is coronavirus disease discovered in 2019. The name of organism that caused this disease is SARS-CoV-2. This stands for severe acute respiratory syndrome that cause several similar diseases including SARS, H1N1 and the common cold and influenza. Now the symptoms of COVID-19 are the fever, cough and difficulty in breathing. If a person sees that the symptom, the person must immediately contact the government helpline number given in this slide. If you know that the person with whom you have been in contact has been identified as positive for COVID-19, then the person must contact on the helpline number immediately. Now I'm gonna discuss about the background of this disease. In January 2020, COVID-19 was designated a public health emergency of international concern, having the first surfaced in Wuhan, China in December 2019. On January 30th, 2020, the first case from India was reported. Devastating waves hit India, especially the second wave in 2021 that was caused by the Delta variant. More than 34 million cases and 4,80,000 recorded deaths occurred in India as of December 2021. India's health system was overburdened by the sheer magnitude, exposing significant public health concern. Now let's talk about the aim. Firstly, we aim to examine the timeline and the major impact of COVID-19 outbreak in India between 2019 to 2021. India faced an extraordinary public health crisis during this time, and understanding the key events is critical for the learning how pandemics unfold at such a large scale. Secondly, we aim to assess the international response, focusing particularly on the role of World Health Organization through a open health perspective. One Health reminds us that human, animal and environmental health are deeply interconnected, and this pandemic highlighted those links more than ever. Finally, we aim to identify key strengths, weakness and importance lessons from the outbreak and the responses. These insights are essential for the strengthening global system and better preparing for the future pandemics. Through this examination, assessment and identification, we hope to draw a meaningful strategies that can help the world respond more effectively to future global health emergencies. To evaluate the international response to the COVID 19 pandemic, we employed a structured methodology that includes several key approaches. First one is literature review. We begin by the analyzing a wide range of sources, including report from the World Health Organization, national government data, and peer-reviewed article to understand the timeline, severity, and impact of COVID-19 in India. Next is case study analysis. We specifically focus on the COVID 19 response in India, examine local, national, and international measures. We applied a One Health framework to assess the coordination between human, animal, and international environmental health responses and how this integrated approach shaped the pandemic response. Next is framework assessment. We utilize the WHO emergency response framework and international health regulation as tool to critically analyze the effectiveness of the response in managing the pandemic, especially in terms of surveillance, preparedness, and rapid response. And next is data analysis by examining the epidemiological data such as case counts, mortality rate, and the vaccination efforts. We assessed the strength and gaps in India response, identifying area that needed improvement for better management of future outbreak. And the last one is comparative analysis. We compared India's response with other countries, noting what worked well and what did in terms of policies, implementation, coordination, and public health measures. This methodology provides a comparative and comprehensive evaluation of how effective the international bodies like WHO and national government responded to COVID-19 and help us identifying key lessons for future health crises. So the next is local and national response. In local response, as the first cases emerged, states like Kerala and Maharashtra act quickly, implementing early lockdown in hotspot areas and strict quarantine measures. Testing and isolation protocols were set up locally to contain the virus, especially in high risk area. Local hospital adapted by converting facilities into COVID care centers, while private healthcare provider partnered with the government to expand testing and vaccination. Awareness campaigns were launched to educate the public on hygiene, social distancing, and mask wearing. Next is national response. On March 24, 2020, India imposed a national-wide lockdown, halting non-essential activities and suspended public transport. The government established a national task force to oversee testing, contact tracing, and treatment protocols. Private and public hospitals were repurposed to manage the surge in cases. On January 16, 2021, India launched one of the largest vaccine campaigns globally, prioritizing healthcare and frontline workers before expanding to the general population. The center government also set up an emergency COVID 19 fund to support states with medical supplies and enhance the healthcare infrastructure. India worked closely with the WHO and became a key vaccine supplier globally, helping the neighboring countries through the COVAXin initiative. Next is international response. During the COVID 19 crisis, international support was vital for India. The WHO provided crucial technical guidance and advised on vaccine rollout, strengthening India's response during the early months. Global donation including oxygen tank, ventilator and medical team helped alleviating the pressure on hospitals, especially during the severe second wave. The COVAX initiative aimed to ensure fair vaccine distribution, but delays due to the production and logistical issue hindered timely deliveries to India. Additionally, vaccine nationalism with wealthier countries prioritizing their own needs further delayed the vaccine access for India when it was most needed. Now, the challenges faced by the national and international response. Managing the COVID 19 revealed the significant obstacles from overwhelmed health system to misformation and delayed in diagnosis, particularly in rural area. At both global and local level, challenges like vaccine nationalism, broken supply chain, and healthcare inequality worsen the crisis, leaving many regions vulnerable. Key barriers to effect the management include poor coordination between government, international bodies, and local health authorities. Slow surveillance and low public trust in health measures made it harder to control. Next is key lessons learned. Reflecting on the global response to COVID 19, several key lessons have emerged for future pandemic preparedness. First one is equality in pandemic response. The crisis highlighted how the inequality in healthcare access worsened the spread of the virus. Ensuring fair access to medical resources, vaccine, and treatment in both a moral duty and the essential for controlling a pandemic effectively. Next is strengthening local infrastructure. In this, the areas with reversed healthcare systems manage the crisis better. Strengthening local healthcare services is crucial for rapid response to further health emergencies. The last is surveillance interference. In this, the pandemic often arises from the interconnectedness of animal, human, and the environment. A One Health approach is vital for early detection and containment of future outbreak. Now let's talk about some recommendations. Based on these lessons, here some recommendations are: first one is build global early warning system. In this system, incorporating the One Health approach are essential. Monitoring the disease outbreak at the animal human environment interface can help to reduce the potential pandemic earlier. Second is strengthening and fund IHR mechanism. The international health regulation framework must be strengthened and better funded. This requires investment in infrastructure and international collaboration to ensure quick response to outbreaks. Next is ensure the fair vaccine distribution. To prevent disparities in global health outcome, vaccines must be distributed equitably across all countries, regardless of economic status, addressing the issue raised by the vaccine nationalism. The last one is integrated One Health education. In this, education should be integrated into public health strategies, training further healthcare professionals to understand the interconnectedness of human, animal, and environmental health to build more resilient health system. Now the conclusion. COVID-19 showed us that the global response to health crises need urgent improvement. Despite many efforts, the pandemic revealed deep gap in how preparedness and united we really were. We saw major gap in preparedness, equality, and coordination. Access to vaccine and critical supplies was unequal, and weaker health systems struggled the most. They highlighted how the global health must be treated as a shared responsibility, not a competition. Moving forward, the strengthening surveillance and the global cooperation is essential. Early detection, faster information sharing, and the cross border collaboration must become the norm, not the expectation. Finally, the One Health approach reminds us that the human, animal, and environment health are deeply connected. To prevent further the pandemic, we must protect all three together because protecting one protects us all. The pandemic taught us hard lesson. Now it's time to act on the together. We have to power the build and safer, healthier world, but only if we choose to act now. So these are the references. Thanks for your attention and time today. As we move forward, remember the health of the people is the foundation of the happiness of the people. Let's continue striving for a healthier world.